We'll start remarks with Dr. Sarah Cody, Health Officer for the County of Santa Clara and Director of the Public Health Department, followed by Dr. Angela Suarez, Primary Care Medical Director for Santa Clara Valley Healthcare. We'll then take questions in English, and we'll follow with presentation in Spanish and additional languages. With that, I'd like to invite Dr. Cody to the podium.
Thank you, Britt. Good afternoon. Good to be back. Mostly I want to answer your questions, but we're here today primarily to encourage everyone to get their new COVID vaccine. So there's a new formulation of the COVID vaccine. It's available. For those with insurance, you can go to your healthcare provider or to a pharmacy that takes your insurance to get the vaccine. And then for those with Medi-Cal, of course, you can get the vaccine. And we're doing everything we can to enroll folks in Medi-Cal if they don't already have it, so that they can get their both seasonal flu and COVID vaccine. So my main message is that yes, COVID is still circulating, and yes, you still need your vaccine. And there's an updated formulation. So happy to answer questions, or Dr. Suarez, would you like to make a few remarks and then we'll both take questions? Wonderful. Thank you.
Hi, I'm Dr. Angela Suarez. I'm the Primary Care Medical Director for Santa Clara Valley Healthcare. Vaccines in all routine healthcare are vital to our work of creating a healthy Santa Clara County. Santa Clara County has a great record of helping our residents find health coverage. The best estimates are that about 96% people here are covered, and recent Medi-Cal expansions mean that more people are eligible and have gained health coverage in the past couple of years. But there are still tens of thousands of people in our county without health coverage and who may be eligible for it through Medi-Cal or other programs. Whether you're uninsured or facing high out-of-pocket costs with insurance, our Healthcare Access Program, HAP, may help you get the care you need. It offers free or discounted medical services and supplies to those who qualify. We'll also check your eligibility for Medi-Cal, Covered California, and other public health programs to ensure that you get the best support available. Learn about HAP at health.sccgov.org and look for Help Paying Your Bill. The county health system can help with health coverage enrollment if someone does not have health insurance or a regular doctor. Call Patient Access at 1-866-967-4677 for help. Thank you.
Thank you, Dr. Suarez. Dr. Cody, at this time, we're happy to take questions. Take your time. We have one additional reporter joining the press corps, so we're going to give him just a minute.
With vaccines now possibly having a price tag for certain members of the community, are you concerned that that might bring down overall numbers of people going out to get vaccinated?
So the question is now about vaccines and that they're costly. So if you don't have insurance, what do you do? So recall that we had a bridge access program for people who couldn't pay, and that is just sunset. In Santa Clara County, I think that we have a mechanism so that anyone who needs a vaccine can get a vaccine. People with insurance, their insurance can pay for it. People who are eligible for Medi-Cal, we will help you enroll in Medi-Cal. And people who, the small number of people who are not eligible for Medi-Cal, the county has other programs. The bottom line is we want to ensure that everyone who needs a vaccine, which is everyone 6 months of age and older, gets a vaccine.
And what are your thoughts thoughts on the currently circulating variant in Europe and what that might mean for our fall and winter season?
So the vaccine, the reformulated vaccine that's on the market now and available, is pretty well matched to what's circulating now. We know we've been living with COVID for 4 years now, that this virus continually mutates and changes. So I can't tell you what will be circulating at the end of the winter virus season, but right now it's a pretty good match.
And where are we right now as far as wastewater numbers? It looks fairly good compared to where we've been, really.
We follow the wastewater surveillance to get an understanding of the level of transmission. We saw quite a bit of activity over the summer and it was sustained. Right now, most of the wastewater sheds, the levels have come down, but we anticipate that they will rise this fall, as they have every fall since the beginning of the pandemic. And that's why we recommend that people get vaccinated. Anytime between now and Halloween is probably a good time. And again, everyone 6 months of age and older, we recommend the vaccine. If you've had a COVID infection, we recommend that you wait 3 months before you get another shot.
In terms of timing, who should do it now? Who should wait till the end of October? If you get the flu shot right now, should you wait a little bit till October? What's the advice?
Well, the advice on timing is always tricky because it's very difficult to time. We know that the flu season peaks at a different time each year. It's difficult to predict. We also have seen that COVID peaks at different times and difficult to predict. So my recommendation would be, one, if you have the opportunity to get vaccinated, you just go ahead and get vaccinated, right? Strike while the iron's hot. If you're someone who always happens to be in the pharmacy getting this and that and the other, and it doesn't matter, maybe wait just a little bit and watch the wastewater and get it as the wastewater is beginning to pick up. I also still strongly recommend masks indoors when you're in a crowded setting with a lot of different people. That will protect you too.
Are the new boosters available?
The new boosters are available.
Talk about the severity of this so yes, it's hitting all of the danger.
Yeah. Well, as the pandemic has worn on, the impact of COVID on hospitalizations and deaths has thankfully decreased. However, COVID is still more deadly than flu. So that of all people with COVID, a higher percentage with COVID will die than that percentage who will die with flu. So it's still, it's still serious. And that's why, of course, we recommend boosters when they come available, as they are now. And when the wastewater goes up, we recommend adding additional layers, including masking indoors. Yes, some people are at risk of more severe illness or death from COVID, as well as flu, and that would include people who are older or people with a chronic health condition that will make them more likely to have a severe illness and require hospitalization.
Slow uptick of the continuing with vaccines, separate from the whole anti-vax, which is the exhaustion from it all. In terms of not something to be exhausted about as we head back into winter. Is there anything to be said about multiple cases causing? We hear about issues and health issues and so forth and so on.
Yeah, well, the pandemic certainly has caused a great deal of fatigue for everyone, living anywhere around the globe. And in our county, it's no different. But the fact is that COVID continues to circulate, will likely pick up this winter, and may be circulating for years. And so this is a new part of life where you need to get your COVID booster when it comes available. The sequence now is more annual, like the flu shot. And it's just something that we have to fold into our routines. So to be prepared for winter.
Speak to the getting those uncovered, covered with the shot.
Sure. And Dr. Well, yeah, I can I'll give a quick blip and Dr. Suarez can give a quick blip and hopefully you'll get what you need. So in Santa Clara County, we're recommending that everyone 6 months of age and older get their COVID vaccine. In our county, vaccine is available to everyone. Those with insurance will get it through insurance. Those who are eligible for Medi-Cal, we will help you enroll in Medi-Cal. And for those who are the small number of people who are not eligible for Medi-Cal, we have another program. The bottom line is we want to ensure that everyone has access to the vaccine and gets vaccinated this season. Dr. Suarez.
So for those who are uninsured or insured with high out-of-pocket costs, the easiest way would be to contact our patient access services. And the phone number for that is 1-866-967-4677. Yes, we would like for as many people to be covered by some sort of health coverage as possible so that they have access to these, not just these vaccines, but also to any type of routine health care. Correct. So previously, vaccinations were covered by federal, and they are no longer. And so now insurances, health plans are having to cover the vaccines. And that's why we want to make sure that everyone in Santa Clara County has some form of coverage to be able to access the vaccine. Yes, we are having clinics, and they're starting up next week. And so we have for our patients through our Valley Health Centers a schedule of access to both flu and COVID vaccines.
If there are no other questions for Dr. Cody and Dr. Suarez, we can now turn to the portion of the presentation in Spanish. I'll invite to the podium Dr. Krishna Sarasi, Assistant Health Officer. Dr. Sarasi?
Buenas tardes. En agosto de este año se autorizó una vacuna actualizada contra el COVID y recomendamos que todos de 6 meses en adelante reciben la vacuna actualizada contra el COVID porque proteja contra los tipos de COVID que están circulando en la comunidad actualmente. Para los que tienen seguro médico, la mejor manera de recibir la nueva vacuna es ir a su médico habitual o ir a una farmacia cubierta por su seguro médico. Para los niños que no tienen seguro médico, pueden recibir la vacuna contra el COVID a través del programa de vacunas para niños, o en inglés, Vaccines for Children. Y para los adultos que no tienen seguro médico, muchos adultos son elegibles para inscribirse para Medi-Cal y pueden recibir una vacuna de bajo costo o gratuita por Medi-Cal. Y no importa su estatus migratorio y no afecta su posibilidad de convertirse en residente o ciudadano. Y si necesita ayuda para encontrar un médico o inscribirse para seguro médico, pueden llamar al Departamento de Acceso para Pacientes del Condado al 866-967-4677 o acudir a 770 South Bascom Avenue en San José entre las 8 de la mañana y las 4:30 de la tarde, de lunes a viernes, o visitar health.sccgov.org y buscar Help Finding Healthcare Coverage. ¿Preguntas? Ok, gracias.
Are there any questions for Dr. Sarasi? If none, we'll conclude the presentation here, and remarks in Vietnamese are available as one-on-one stand-up interviews. Thank you.